This is Dr. Jennifer Jansen from the Zepf Center. You're listening to JJ's Clinical Connection, connecting you to clinical topics. Welcome back. We're so happy you're here. Today, we're stepping inside of one of Zepf Center's most impactful resources, our on-site pharmacy. From providing the latest behavioral health medications to making prescriptions more affordable and accessible, our Genoa Pharmacy team works every day to break down barriers to care. In this episode, we're joined by Associate Director of Community Pharmacy, Jonathan Shaffer, and Consumer Medical Coordinator, Cheri Potter. Together, we'll talk about everything from insurance hurdles and medication shortages to med packs, home delivery, and the 340B pharmacy program. Whether you're a provider, a client, or a community member, this conversation will give you a behind-the-scenes look at the vital role our pharmacy plays in recovery and wellness. Stay tuned. Good morning, Cheri and Jonathan. Welcome to the studio. Would you like to introduce yourself to our listeners?
Sure. I'm Cheri Potter. I'm a consumer medication coordinator for Genoa Pharmacy. We're located on Nebraska Avenue.
Hi, thanks for having us. My name is Jonathan Shaffer, and I am the Director of Community Pharmacy for Genoa, and we serve the Zepf Center inside the Nebraska Avenue location. And I have been a pharmacist for 9 years, and I graduated with my Doctor of Pharmacy from the University of Findlay.
Great. Well, I'm excited to have you guys here, and we're going to jump in. Tell us a little bit about Zepf Center's on-site pharmacy and how it supports our clients.
We are inside of the Nebraska Zepf Center, where the vast majority of the individual sort of one-on-one provider-patient interactions happen. So we're on site there to provide medications the same day, to deliver, to mail, and then we also make sure that Zepf Centers, that their med rooms are stocked with injections, with medications for the ACT team. And then Cheri also works inside of the Ashland building, and I'll let her tell you a little bit about how she provides that service for the Ashland clients.
Right. So I pay close attention to all my patients and when their refills are due and such. I always pick up my medications from Zepf Center on Nebraska. I do deliveries every day. I deliver for our patients as well as our staff. I'm right there in the building at Ashland, so if there's any questions from providers or nurses or any other staff, I'm there for them. I've always got goodies in my office and candy and giveaways, so it's a popular spot.
It is. What makes having a pharmacy on site at a behavioral health center like Zepf Center unique and helpful?
I think the primary thing that we are able to provide by being on site is access and communication. We are right there. We are in the same hallway, so we can dialogue about clients, about consumers in real time. We don't have to play phone tag or voicemail tag or send faxes. We're looking at each other face to face and having those conversations. And the other thing is the way that I think we can integrate through, like, for example, access to Teams, where when a provider has an issue with how something is prescribed in the EMR, we can get on a call or on a chat with HIT and IT and the provider and their nurses and work through a solution, which is something that we're doing more and more regularly to make sure that those prescriptions are written as safely and effectively, and also trying to make it as easy as possible for the providers to, serve and get that care going out.
It reminds me a lot of the past experience of people picking up their medications where they knew their pharmacist. There was a personal connection. Cheri, I know you know a lot of our clients. I know you know all of our staff, and they feel comfortable when they see you, right? They have that connection. It's a familiar and a friendly face, and I think that makes it really special too.
Yeah, I try to keep my office colorful. It brings in new guests and are curious as to what I do. So that's really helpful, my location in the building. So providers have access to me, patients have access to me, nurses.
Yeah, and I imagine that they often ask questions, too, about medications that you're able to educate them, provide information, and it doesn't have to be something that's scary or unknown.
Correct. A lot of times it's questions about insurance and billing and why something isn't going through insurance. So we work on the prior authorizations to make sure we get those sent out so our patients can get their medications. So it's another way that I can help being in the building.
Can you explain what the prior authorization is and why it's such a common frustration for patients and providers alike?
Prior authorizations are typically for expensive brand name drugs, so a lot of insurances aren't going to cover them right away. So we have to send the form out to the provider and nurses and have them completed on their end. A lot of times it's because the insurance wants to know, is this medication really necessary? So it can be frustrating for the patients because they don't understand why we're not giving them their meds right there. So a lot of times it comes back on us, and we just have to explain to them, it's not us, it's your insurance, and we're working with them to get this pushed through.
Let's talk a little bit about insurance. What are some of the common questions or hurdles that clients face when it comes to getting their prescriptions covered?
Certainly, prior authorizations are top of the list. They typically break down into two categories. When there's cheaper alternatives, a provider needs an expensive medication for some reason, and they'll pick that expensive alternative over cheaper available options. And part of that is just a justification as to why that additional expense is necessary, which is a cost-saving measure. And then some of it is a disease state or safety confirmation. So, for example, before you're able to treat somebody for hepatitis, the provider would have to confirm with the insurance through blood work and testing that either they have hepatitis C positive antibodies or an RNA positive for hepatitis C. So some of that is to confirm that the medication is going to be necessary and safe in that way. And then certainly copays. Nobody likes to pay copays, and nearly everybody has to pay copays. So we try to give some explanation as to why some copays have changed, how tiering works from cheapest medications for the consumer to most expensive, and then also with the providers to help them work through those prior auths to make sure that the required diagnosis codes, the required information is being sent to the insurance company so we can have the highest chance of getting that claim approved for them.
Great. Well, many of our clients rely on antipsychotic medications. What are some of the newer antipsychotic drugs being prescribed today, and how do they differ from the older options?
That's a great question. We certainly have had some new breakthroughs in this area from completely new classes of medicine, what I might call a third generation antipsychotic, which is xanomeline, and that's known as Cobenfy commonly. And so that is a completely different class of anticholinergic antipsychotic. It doesn't affect dopamine, so it gives a completely different profile of efficacy, and also some of the big side effects that can potentially be lifelong side effects, like tardive dyskinesia, are taken out of play by changing a mechanism. So that is one example where we now have a new tool in the tool bag, if you will, for folks with severe tardive dyskinesia risk, that we can treat their state in a completely different way, and that's new. And then, some things that are not necessarily completely new drugs, but new formulations that are less painful to receive injections because they're less viscous. They can carry a smaller needle. So we've had a good success there. And also some non-antipsychotic drugs, like new ways to treat pain that are non-addictive for individuals with a history of substance use disorder. We can treat with sodium channel blockers potentially now, as opposed to opioids or other medications that risk relapse and addiction. So we certainly have some new options across the board for the different clients that would go to the different Zepf Center properties.
That's really exciting. Medication adherence is a big challenge in behavioral health. Can you explain how things like med packs and blister packaging helps improve consistency and safety for clients?
One thing that Genoa offers are what we call disc pills, which is basically we are doing your pill organizer for you. We can print those out with days and dates to help with compliance and to help with any confusion. It's all free of charge. We also have little bubble cards. They kind of look like bingo cards, and it makes it easier for them. They can just push their medication right out through the foil instead of trying to struggle and open a bottle. We also work at getting everyone's medications, especially our patients that are on many medications. It's kind of a formula to get everything to be due on the same day. So sometimes we have to do shorter day supplies so we can match that up with the pack. So when it arrives, the patient has everything that they need. And then we, of course, have free delivery.
That's wonderful. What happens if a medication is out of stock or there's a national shortage? How do you work around that to make sure that patients aren't left without what they need?
We have a few options that we can do. The first option that we have is, because we're part of a larger company, we have a depot of medication that we can move around. So we will ship medication across the country from one Genoa to another to make sure that the pharmacies that are utilizing that particular medicine have it in stock for as long as possible. When that's not available, we have multiple wholesalers that we can rely on to try to utilize that medication while it's still available. And then as it goes on stock, that's where we're working in a face-to-face option to say, well, we could double up, or we could switch, or we can convert from extended release to immediate release and have them take it twice a day for the next month. So there's different clinical options that we could use. And then when all else fails, looking for a suitable therapeutic alternative that will be sort of a second best option until we can get back on board with their preferred agent.
Zepf Center is a 340B provider. For those who may not know what that is, how does it benefit both the pharmacy as well as our clients?
Sure. The 340B is a great program that is designed to keep critical access healthcare facilities open and operating in these sort of new times of decreased reimbursement and payment challenges, additional cost, etc. So this gives us an opportunity for a covered entity and a covered pharmacy to provide care for a patient using subsidized cost medication. So we can then take the value of that medication and put it back into patient care. So by providing our services, we are expanding our reimbursement options to expand what we can do then and make sure that these critical access care facilities like Zepf Center, like Genoa Pharmacy, remain open, remain operating, and are able to provide that extra services that we need to, especially in the uncertain grant timing and funding area that we are finding ourselves in.
Absolutely, and I'd like to talk a little bit about that. Are there grants or assistance programs that you can tap into to help patients who can't afford their medications?
Well, one thing that Genoa does for our patients that are on expensive brand name drugs with private insurance, we're able to look up copay cards and help get those copays down to where it's manageable. That's one thing I really enjoy doing. It's exciting to see that copay drop from $500 to maybe $25. So that's one thing we're able to provide. And also, if we search for free meters if a patient is prescribed glucometer and diabetic supplies. A lot of times that's not covered. So we will search and find free meters, and that way they're able to get everything that the doctor has ordered for them.
That's great. I know you guys are very client-centered. I can tell that the passion that you have for your work is really about connecting with the people who need medications to be healthy. Tell us a little bit about medication delivery, if you offer that for clients who have mobility challenges.
Sure. We absolutely provide same-day delivery to the Toledo area. And then throughout all of Ohio, we are mailing prescriptions, and that's available also for free as a courtesy service. So a lot of times folks will be going to another part of Ohio to visit family. We can have their medication mailed to them while they're there, and then they can get back on delivery while they are here. And then Cheri is also providing daily deliveries to all of the Zepf Center properties. So I'll let her talk a little bit about that.
Yes, I deliver to all the Zepf facilities. I deliver every day. It also gives me a chance to speak with the patients when I'm at those group homes or our recovery house. So I do get to speak to them. They know me. They'll come up and ask, if they have questions with their medications. Why didn't I get this? Well, we had to order it, or just questions in general. I can refer them to Jonathan if they are starting a new medication. But I do have a really good relationship with everyone I deliver to. They enjoy it.
From your perspective, what is the biggest barrier to medication access today? And what can community-based providers like Zepf Center do to help bridge that gap?
I think the biggest barrier that we have, and it's fairly new and evolving, is a combination of patient access deserts and burnout. So when we're seeing, for example, in 2024, over 200 pharmacies just in Ohio closed. So we're seeing through issues in reimbursement, through burnout, through contract issues and consolidation in general, we are seeing fewer and fewer pharmacies available, and that's affecting individuals both in sort of a very urban inner city area and then rural areas as well. So this is probably the number one issue as far as access goes. And I think as those pharmacies close, you're seeing the remaining pharmacies struggle under the duress of safely filling all of those medications. And I think that has also sort of applied to many providers as well, where you may call and try to schedule an appointment and it'll be months out, or you may call and try to get a hold of your pharmacy and you may wait on hold for 30 or 40 minutes trying to get to somebody because unfortunately there's just nobody there to answer the phone and to provide that care and access. So I would say that's the elephant in the room when it comes to access and patient care. In that case of certainly when it comes to wait times and getting involved in endless phone loops, we don't have an automated system that answers our phone. When you call our telephone number, it rings a phone and a person answers. There is no press 1 to talk to somebody or press 2 to leave a voicemail. We have a real person on the phone and they will pick it up when you call us. We have a real employee that takes medicine to you and will talk to you about it, and they will connect you to me, and I will answer your questions. I'll teach you how to use your inhaler and what to expect when you start a new medication. It's not an endless loop of telephone operators and FAQs online and potentially areas that might give you wrong or misleading information. It's safe, effective management for your questions where you can get it from a trusted source that's a real person.
And I think this ties into quite a bit of our trauma-informed care, which I've spoke about before on this podcast. And trauma-informed care honestly starts with creating a safe space. There are components of taking medications or starting a new medication that can be scary. And it sounds to me like the connection and the personalized support that Genoa Pharmacy provides to our clients really helps them feel maybe empowered, knowledgeable, that they can ask questions and that they can be an active participant in this part of their treatment.
I think that that's definitely true. And I think that, for example, two examples from just this week already, I showed somebody how to disassemble their inhaler so that they can clean it, so they can make sure that they're getting their correct dose. And in that case, most people don't know that that particular inhaler can be disassembled and cleaned and then put back together so that they can get their full effective dose. Or for example, when we're starting a new antidepressant, people need to know that they're not going to feel better right away, that they might actually feel worse for a little while before they get better, because that list of side effects is long and it's scary. And if that's all you're going on without any context as to what might happen or what you might experience, it's very likely that you might fail treatment because of the unexpected things or the roadblocks that you weren't prepared for.
How does being an on-site pharmacy allow you to better coordinate with Zepf's medical and behavioral health teams?
Certainly, it gives us the opportunity to interact with the patients and the consumers that have the most need. So, for example, ACT team clients, where we meet with the ACT team nurses every day, sometimes 2 or 3 times a day, to provide their dose changes, to provide their packs, to navigate their very quickly changing doses and environments to adapt to their needs. And then being able to have a provider meet with the patient and say, no, I think we need to change this dose now. We need to have them on an injection, or they've agreed to an injection for the first time. But, if we're not able to provide it very soon, they may change their mind. And the provider strongly believes that this is the best thing for them, and the patient is willing to do it at this time. So we can adapt very quickly to situations of dose changes, new starts, ACT team, where maybe hours or days are not enough, would be too long to provide this care. We can adapt very quickly and then have a dialogue about patients that maybe there's a concern about diversion or overutilization, and we can have a dialogue that maybe needs some back and forth, where that would be very difficult to do over email or through a fax chain.
And Jonathan, you mentioned our ACT team, and ACT stands for Assertive Community Treatment. We have a interdisciplinary team, so psychiatrists, therapists, case managers, and peer support specialists who work with a group of our clients that have some significant mental health conditions. Many of those clients, as you mentioned, have medication changes on a regular basis or take multiple medications for their mental health conditions. And it sounds like you guys really work collaboratively with that team to provide access in real time. Cheri, what are some of the benefits that you've seen over the years about your personal connection with the people that you deliver to?
Well, I'm definitely able to be more social now. I started out in the pharmacy as a pharmacy tech, so I was staring at a computer all day long. Being promoted to consumer medication coordinator, I'm a lot more social. I'm out there with the patients, talking to them, maybe just about their day if things aren't going right, or any pharmacy questions that they have, any issues. If we need to transfer prescriptions from another pharmacy, we're able to do that. That way we can make sure they're getting all of their medications and they're staying compliant.
For anyone listening who might be struggling to afford their medications or worried about side effects or just unsure what's available, what advice would you give?
I would say the first thing that we would want you to have the opportunity to do is to ask, to make sure that you know that you can talk to us, that you can ask questions, that no questions are off limits, and that this is a place where you can safely and securely have your questions answered to prevent sort of those scary outcomes, that misinformation, all of those things that are available. and to allow us to give you an opportunity to be part of that team where we can work with your case manager, we can work with your provider to cover those copays. If you're part of CMS, you might be eligible for grant funding that you don't know, and we have many people that successfully get DAP and grant funding that come through the pharmacy, and that is, tens and hundreds of thousands of dollars of access that we're able to provide. And sometimes it starts with, what can I do? A simple question from the consumer. How can I get through this? How can you help me? What should I do next? And those are often the sort of things that get the snowball building down the hill.
Well, any direct medical questions, I'll refer them to Jonathan, of course. And as far as patients worried that they won't be able to afford their medications, we can always do price checks. Sometimes there's medications that are prescribed that aren't covered by their insurance, and we offer a discount card. So we're able to get it down to maybe where it's a bit more affordable for them.
And even in the option where there is a significant copay that the patient is responsible for, we have several different options for payment plans and things like that, where perhaps they have a payee that we will work with and coordinate their payment plan through and make sure that is done. So whenever possible, we are trying to take finances and copays and payments out of the picture to make sure that nobody goes without their medicine.
So what's your favorite part about working in-house at Genoa Pharmacy inside the Zepf Center?
Well, I love being social, as I said before, and there's other ways that Genoa gets to know their patients. We have contests. We just closed the deadline on our art contest that we have every year. The pictures selected will be in the calendar for 2026. I always make sure if they're my patients, I also have little special goodie bags for them as prizes, because it's hard to choose who's the best, who's the best artist, who's the most creative. So I have goodie bags for them with art supplies. And I'm getting ready now for Chalk the Walk that the Zepf is hosting. I'm going to be having book bags with books, school supplies, water bottles, things like that. So I'm looking forward to meeting some new people there.
Great. Yes, and I have some note cards, I believe, that were printed out of some of the artwork from your previous contests. That's really incredible that you guys kind of come that full circle with clients and engage them in other ways that they can be healthy and well.
Right, exactly.
Well, thank you so much for the conversation today, Cheri and Jonathan. It was great to learn more about Genoa Pharmacy and all the services that you provide for our clients.
Well, thank you for having us.
Yeah, thank you very much. And I know I had a lot of fun. This was my first podcasting experience, and this was a blast. So thank you.
Great. Thank you, guys. That wraps up this month's episode. Thank you again to our on-site pharmacy team for their incredible work ensuring that our clients have the medications and the support that they need. Remember, access to treatment isn't just about having a prescription. It's about removing barriers to recovery and to wellness. If you enjoyed this conversation, be sure to download it and share this episode. For the latest clinical connections, subscribe to Spotify, Apple Podcasts, or wherever your favorite podcasts are found. For more information about Zepf Center's on-site pharmacy services and other resources mentioned in this episode, check out our show notes. For more information on Zepf Center, visit us at zepfcenter.org or find us on Facebook, Instagram, and LinkedIn. Until next time, this is Dr. Jennifer Jansen signing off.